Good
We are
morning,
live on
everyone.
YouTube.
Huh? Are
Hold
we
on.
ready? We ready, Steve?
Yeah.
Good morning, everyone. Welcome to another series of Black Health Now, sponsored by Omnicom Health Group and hosted today by Matthews Media Group, or MMG. Our topic will be Blacks in clinical trials, and I have a panelist group of experts from different backgrounds around clinical trials. This should be a lively discussion, and I hope that it is very educational for the group. Any questions or any concerns that you have, you can always put in the chat. And we will get started. What I would like to do is for my panelists to actually, I'm going to introduce their names and then I'm going to allow them to introduce themselves to the group. My first panelist is Maurice Butler, who is a patient and an advocate in the community and has participated in clinical trials. My other panelist is Deonde Colquitt, who works for MMG and is a social media, marketing, advertising specialist, a lot of experience on the pharma side. Dr. John Hogan, who has over 40 years experience as a doctor, internal medicine, and an HIV specialist. And Mr. Rodney Lewis, who is a program manager in the community and an advocate for Blacks and gay Black men in the community. Welcome, panelists. I appreciate you all for participating in this very innovative and very important topic to the Black community. Could you all introduce yourself briefly, and then we'll get into our topic.
Charlita, hi, my name is Deonde Colquitt, and I am the Outreach Director for Matthews Media Group. I have about 5 to 6 years experience in recruitment for clinical trials. I've worked on the site level with clinical trials, working with neurologist and a sleep specialist for a company called NeuroTrials Research. So I'd like to say that I've had my feet on the ground, but also it's been a pleasure working with Matthews Media Group. We have really worked with different indications for clinical trials from Alzheimer's to COPD to all different types, from rare conditions to actually conditions that are prominent in all communities. Great to be on this panel, and I look forward to working with everyone.
Thank you, Deonde. Dr. Hogan?
I'm Dr. John Hogan. I work in Washington, D.C. for Unity Healthcare, where I work at 3 healthcare centers and the D.C. jail. I'm also the medical director for Regional Addiction Prevention, Inc., RAP Incorporated, which is one of the oldest residential substance abuse treatment programs in the United States. And I worked with Charlita since the early 90s with the principal investigators from NIH when they came into Upper Cardozo Clinic to recruit for clinical trials. Thank you, Charlita.
Thank you, Dr. Hogan. Rodney?
Yes, good morning, everyone. My name is Rodney Lewis, and I'll just add, in addition to my experience working as a program manager in the communities here in Northern Virginia, I've also worked with a lot of special groups, especially in the area of community outreach, which includes persons who are reentering citizens or persons who are experiencing incarceration, in addition to individuals who are oftentimes disproportionate when we're talking about different sorts of diseases and illnesses, and understanding their needs and tailoring programs so that they meet the needs of the person. So I'm excited to be on this panel to share in this discussion, and thank you again, Charlita, for inviting me to join.
Welcome, 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 Rodney. Mr. Butler?
Hi, I'm Maurice. I'm a Maryland resident and a participant in clinical trials. I was introduced to clinical trials through Ms. Charlita a little over 2 years ago. I do appreciate the opportunity to participate in this discussion.
Thank you, Maurice. I appreciate you. I appreciate you. I wanted to get started. So Blacks in clinical trials is a really sort of controversial topic, goes way back. We have historical roots of a lot of mistrust. So this is where I'm going to set the stage. Early on, or in general, when we approach somebody about clinical trials, the first thing they talk about is you're going to use me as a guinea pig. And so the first, so with that in mind, what comes up first is the Tuskegee Institute syphilis study, where African Americans were put on a study and actually died on the studies. I guess so nobody gave them any medicine. They thought that they were getting medicine for treatment of syphilis, and they were actually getting placebos. So people died, people went blind. A lot of atrocities happen. So in the Black community, when I'm recruiting, what usually happens is that's the first thing that comes up. And before I can talk to anybody about clinical trials, I have to dispel, or I have to actually address the elephant in the room. And the elephant in the room is always the Tuskegee Institute and the abuses that have happened in the past to African Americans in general. In addition to that, I would like to highlight the Henrietta Lacks story, which is about cancer cells and how her cells were used without her permission. Unfortunately, back then, there was not a lot of consents given, and people didn't ask questions. People just used your stuff and they didn't ask for questions. Now you have to give consent for every blood tube, every consent, every gene, every piece of whatever you're donating or anybody is asking you to donate, you have to actually give consent. So I'm going to set the tone with there's been a lot of mistrust, medical mistrust, that has led to why Blacks don't participate in clinical trials and why the numbers are so low. I'm going to actually start off by saying that just in general, in the general population, African Americans only constitute 5% of all clinical trials participants across the discipline, just in general. So we're talking about different diseases, that kind of thing, but 5% of African Americans actually participate in clinical trials across all health venues. So let's get started and have a candid discussion about what your thoughts are, what you see in the community, what you think may work, and be honest, be honest, because this is about educating and this is about sparking thoughts for us and the people that are on the YouTube channel actually listening to what our thoughts are about clinical trials. And maybe they'll think outside of the box about some of the decisions and some of the things that they're able to do with their clients and with their partners. The first question I would like to ask the panel is, why do you feel like participation is so low in the African American community in general? And what do you think the perspective of clinical trials is in the Black community?
I would like to start off by saying, until you and the principal investigators from NIH started coming into our clinics to recruit for clinical trials, really, there was no contact, there was no other than individual practitioner knowledge about what was out there. It just wasn't there with us being this close to NIH. But, a lot of the major hospitals also do clinical trials, but it just wasn't a lot of contact with practitioners, with Unity being primarily a minority focused treatment, with us having over 15 facilities. It was just basically an effort to go out. We talk about health literacy, about people having knowledge about health. Well, knowledge about clinical trials, just the fact that they are available, one, and what the purpose of them are. Before we can even start talking about dispelling the myths and all this other kind of stuff, people got to know just, well, what were they for? Even with Tuskegee, what was truly the purpose of it, even though it went wrong?
Thank you, Dr. Hogan. Great point. Anybody else want to jump in?
Sure. Just to piggyback off of Dr. Hogan, there's some key several factors, and some of them, again, just exactly what he said, the lack of awareness about clinical trials and what they're for. I would also say economic factors of not having locations or clinics near where African Americans live, and then the communication issue whereas we're talking about African Americans today, but in the Latino community of maybe there's not information in their language for them to understand. And again, the most important thing is the mistrust. And as you mentioned, as we started, that mistrust has been for many, many years in medical research for African Americans. And again, the most prominent example that always comes up is the Tuskegee syphilis study. So those are some of the factors.
Anyone else
Yes.
want to jump in?
I'll add in, I'll actually, by piggybacking off of what Deontay just shared, there's the social determinants of health. And I think when we think about social determinants of health needs for clients that we're trying to engage in these studies, that goes down to transportation, accessibility. Like if the clinic is all the way across town, how can we ensure that the client is going to get to those appointments and make it to those appointments so that they can continue in the trial itself? And then also making it, tailoring like if there's like an incentive program or something of that sort, tailoring it to where it meets the basic needs of the clients that are actually participating. And the other thing that I will also point out is reassuring the upholding of the standard of care. Like, so once someone starts into the clinical trial, what supports are going to be available for them from a healthcare perspective? Like, you know, and then them understand, I think that kind of comes with the education that kind of, you know, precedes the actual engagement, them understanding these are the services that will be available to you while you're going through this trial. Because again, that does help build trust and reassure them that it's safe for them to participate.
Okay. Anybody else? So
I have to agree that, as I stated, prior to meeting you, Charlita, I had no awareness of clinical trials. It was primarily need that really created the environment for me to be able to learn the availability as well as its importance. Since then, I've had various conversations with people that I know. Everybody is aware of the Tuskegee studies. I was even aware of that. However, the language around that is generally negative. There's a negative connotation around that event as well as clinical studies. I was not, although I knew about Tuskegee, I did not think of it in terms of it being a study as much as experimentation. And so generally what I found is when you start talking about clinical trials, most people think in terms of experimentation. And so then you get back into that guinea pig mentality. There's an overarching distrust in the Black community because the healthcare system is just another societal system in which it seems like there is a bias that's been integrated into it. And so that system is not really operating to the benefit of Blacks in general. And so you have to go into it upon situations need. And even then, you have to be very wary of the care that you're getting.
okay. Thanks, Maurice. We appreciate that. That was good insight. Everybody's insight was point on. What
May I make a statement too? I think you asked two questions in that fold of
I did.
what are the issues, but then what are some of the solutions? And one of the things that I wanted to say, and I think everyone spoke on it about, it's about re-educating the community on the ethical changes in clinical trials, and then most importantly, the importance of improving medical treatment. Clinical trial supports, changing diabetes for our community, changing hypertension, obesity, different things like that. There's so many opportunities with clinical trials to improve medical treatment. Also, making sure that we have dedicated resources to support the recruitment and the retention of African Americans and Latinos in studies. And really, I know how strong the African American community is. And to me, it's our individuals within our community sharing information that have influence over our community. For example, if everyone remembers on the panel and who's watching us that during COVID-19, the vaccination campaigns, media mogul Tyler Perry had a town hall meeting just to discuss vaccinations for COVID-19. So, and it just really informed African Americans. I believe he had, and I hope I'm saying this correctly, I cannot remember the name of the doctor, but she was very instrumental in ensuring that people understood how the vaccination was established so quickly and where it was in the system of approval for a drug. So I think those things will help this situation.
Thank you, DeAndre. That was really good insight. Education is key. Dr. Hogan talked a little bit about PACT, and Maurice talked about PACT, which is my project that we work on at MMG actually does. And it's a lot of education. It's not an overnight process, I guess, to change people's mindset. Some days I get somebody and I change their mind on that day, but maybe I might not change their mind on that day. Maybe I change their mind next month. I can say, but it's still a win. So it's a good thing because you just have to keep on laying the seeds. So it's definitely all about education and about people feeling like whoever the team is that we put together, that the team actually really cares about them and their overall health. And I think that comes, Dr. Hogan again mentioned that, there's no better referral than a doctor referral. If the doctor co-signs that they think this is something good for their patient, the patient will sign on to it. I guess we work with a lot of different people. We work with the doctors, the case managers, the social workers, the nurses, the medical assistants. It's a whole lot of people at the clinics that touch all of the patients. And any one of them can be an influencer or change somebody's mind or educator about clinical trials. But as DeAndre said, not just about clinical trials, addressing their underlying health needs first and then introducing clinical trials, which really makes a difference. So thank you, DeAndre, for that, because that's definitely the second part of the actual question. The next question we like to sort of address, and we sort of addressed it a little bit anyway, is what were some of the ethical issues when we talked about that ethical issues in the past, but the question really is, how have we improved on some of the ethical mistrust? What kind of things have been put in place to alleviate some of the abuse that may have happened in the past?
I don't want to overtake the conversation, but I do want to mention that I think the FDA has truly understood that, and they see the percentages that African Americans only make up about 5% of all clinical trial participants. So because of this low rate, in 2016, the FDA prioritized diverse population inclusion in clinical trials. So much so that they created, it's called the Collection of Race and Ethnicity Data in Clinical Trials Guidelines. In 2016, those were established. But just last year in April, the FDA expanded the recommendations of these guidelines from 2016. And basically the guidelines are just encouraging sponsors, pharmaceutical sponsors, to create and submit plans that help support efforts to enroll and retain a higher percentage of diverse, underrepresented populations in clinical trials. So I think what is good about this is that not just, I think everyone across the board that deals with medical and device development, they see the importance of what's going on and the need for improvement.
Thanks so much, DeAndre. I actually saw that, I guess, in the FDA. I don't know if anybody else has any comments about this particular question, but I wanted to address also that in 1973, NIH, or the federal government, because of some of the atrocities in the past, NIH put a mandate in that clinical trials conducted by the National Institute of Health should always include underrepresented populations. Of course, that includes the African Americans. That is actually how the PACT project actually came into fruition with RFP on that particular, and the focus was on to recruit minorities across the board, African American, Spanish speaking patients, women, people from other countries, African countries, Asians. And so up until this point, so that's really like 27 years, 1973 to now, is like over 20 years of us focusing our efforts. And the MMG actually has been doing this for 27 years, focusing our effort on putting together a team and building relationships and partnerships in the community that make a difference. But had the federal mandate not went into effect, we don't even know what the percentage of African Americans participating in clinical trials across the board would have actually been. And so now the FDA, as Deonde just said, is actually coming up with and working on drafts for the other part, pharmaceuticals, private, biomedical companies, that kind of thing, to actually have some of those guidelines in place too, that say that if you want to bring these medicines, to the base, then you have to put some effort into trying to recruit minorities. And we need to know how many minorities you have recruited. Like, what's your game plan? And so that's what the FDA is saying. And so NIH has done that since 1973, saying that we have to have representation for minorities. Deonde also mentioned that, we need to have Spanish speaking people to assist in the recruitment process, but we also need to have consent forms translated into Spanish so that the Spanish population could actually participate. Consent forms in Amharic, so that it opens up the door for other minorities to participate in clinical trials across the board. So I just wanted everybody to know that NIH has been doing that since 1973, and I'm glad the FDA is seeing how important this is for the private sector as well, and bringing new medicines to the forefront.
Can I say something?
Yes, sir.
I just want to add, because she had said, 2016, and I was getting ready to say, wow, NIH started coming into our clinics back in 1995. And I know they were also going to Montgomery County, PG County, Fairfax County, for the sole purpose of recruiting minority people into clinical trials. And that told me also that they had most likely been doing it before 1995. So I was truly impressed that not NIH, but the principal investigators and Dr. Henry Mazur, who was the head of allergy and infectious disease, came out himself into the community to see patients. They had their own room at Cardozo that I would let them be in to see my patients. I came in, I introduced them, and then I left. So that was one thing that truly impressed me. Number two was, as a physician, and we're talking about our biases, our barriers to care, I always thought research doctors were very impersonal. They were like they were lab rats. That's why they did researches. They had very poor interpersonal skills. And from the day that I met Dr. Judy Falloon, it was like, well, why are you talking to me? You are a research doctor. You're supposed to be using numbers or got test tubes or something. But they were so personal. So they broke down my barrier to research first, clinical trials, and everything. And I thank NIH for that, because when I would tell people about it, I would tell them, I'm gonna let you know you've never been treated like this. It's what I could say about your clinical trials.
Well, thanks, Dr. Hogan. That's very, very gracious. And to piggyback on that, the first part of we actually built partnerships. So it's all about partnerships. You cannot go into the Black community and think that you're going to rob them and take what they got and not give them anything back. So the projects, when you're setting up your projects or thinking about how to recruit, it's a win-win for everybody. It has to be a win-win for the patient, a win-win for the doctor. And the clinical trials groups cannot just take and not give anything back. And I think that Rodney spoke to that, we have to feel like you really care about us and that you have our best interests at heart. And it doesn't always have to be something, that costs a bunch of money or anything like that. I guess but we just have to know that you're vested, that you really care about our overall health and not just about your clinical trial. So
And
thank you.
I'll add Charlita too that and showing that you truly care is listening, right? And I think one, like we've talked about the Tuskegee experiment and some of the miscarriage of healthcare that happened with that whole ordeal. And one of the things that came about from that, from an article, this is from an article that I had read up. They mentioned how maintaining that standard of care with any clinical trial actually came from the fact that with the Tuskegee experiment, the treatments for syphilis was withheld. Right. But what they're now stating is that with these clinical trials, that cannot happen. You
Yes.
have to make sure that there is a standard of care. Forgive my background noise. You have to know that there's a standard of care for the clients that are engaged. So I think that means a lot to the Black community because it says to them, you heard us, culturally speaking, and that you're willing to move in a way that's needed to engage us in these sorts of endeavors. So yeah, I wanted to add that as well.
Thanks, Rodney. That was very, very helpful. Let's switch a little bit. I guess I'm going to try to focus. I want Maurice to sort of talk a little bit about why he participated in clinical trials and what some of his apprehensions were about participating.
Well, excuse me. Overall, I would say the driver behind me participating was, there was a sudden change in my health and I had no idea what was going on. There was a recommendation that was made by my PCP for a clinical trial. So because of the relationship that I have with my PCP, I trusted her. That kind of opened my mind to be receptive to it. Again, there were some of the concerns around experimentation and exactly what the approach would be as far as my healthcare. What helped was it was reiterated to me that there would be standard of care that would accompany the clinical trial, and moreover, that's what I was looking for. So I did understand that there was a give and take. And I was willing to do that. So I would say because of such a great unawareness of what clinical trials were about, my defenses were pretty low. I hadn't really been tainted by opinions of society or anything like that, because in times past, I had no interest in it. So I did not have that. I would say the biggest thing for me was that prior to that incident, I really did not have a historical need to have to seek a great amount of medical care. So that was quite different for me to be in that situation. So it was a lot that was coming at me at once. The voices such as yours in particular, and dealing with some of the doctors at the hospital, they really helped to bring me into a reality of what was being offered and what I needed to make a reconciliation between the two.
Thanks, Maurice. Thanks so much. Maurice's perspective, like I said, and of course you can tell that he's my special patient, but he was very different. He was sick. He was really sick at the beginning, but he really came around. And I think that we built a relationship. I could be honest with him, even when the doctors couldn't just tell him just the way it was, so that he could sort of get with the program. And I think that sometimes you think that just because I say something, just because somebody says something to you, that they don't want to hurt your feelings. But for real, when you sick, and you need care. And you need to come to the realization that something is going on. And look, you have to come to the realization, what are you going to do? And sometimes you need somebody behind you pushing you or holding your hand throughout the process, saying that you can do this. This is going to be good. Keep in mind also that, with any clinical trials nowadays, everybody has to continue to have their primary care. So NIH doesn't see anybody, the drug companies don't see people that don't have primary care, not connected to people, because you always want the primary care to be able to follow their patient, and you don't want the patient to fall out of care with their primary care. So that's another big issue in the Black community. We like who we like, and that's why we go to certain clinics, and that's why we frequent certain doctors, like I say, and we like to stay with those doctors. And even though we're going to NIH or going to a pharma study, like I say, we still need to be connected to our doctors and ask them questions on a regular basis too. And the studies are supposed to be sending your labs and your notes to your primary care so they can keep track of you. So that's really, really important. Dr. Hogan, I see you shaking your head. I got a question for you. So from a doctor's perspective, some of your patients that don't participate or didn't participate in clinical trials, why do you think that they didn't want to participate in clinical trials? And of course, you actually sort of spoke on how things have improved over the years. So from 27 years ago to now, how far have we come?
Oh, you've come a long way, but like what was said earlier, it starts with the doctor-patient relationship and the relationship you have with your patient. But still, we know there are some patients, and I don't care whether it's COVID, flu, anything, they don't want any vaccine. So if my patients don't want a vaccine, I think they're going to be very reluctant to get into a clinical trial. If they were reluctant about starting medications, taking medications, or anything like that, that is a patient-to-patient perception of, and we talk about health, literacy, et cetera. We need to take a look at it. I love it. I'm talking about, we could spend all day talking about social determinants of health. And when you look at these social determinants of health and you start talking about going to a clinical trial, and understand it is absolutely experimental. To say that you are a guinea pig makes it look like it's something for small animals, that it's not something for humans. To say that it is a clinical trial, okay, to say that it is a study, we're talking about human beings. When you start saying stuff, and I allow my patients to bring it down to the level of guinea pigs, I'm the one, when they go down, I have to bring it back up and say, this is the only way that we're going to know about not just cancer therapies, but surgical procedures, different things for cancer, different things for your heart, not to mention just medications. But again, sometimes Rome wasn't built in a day. Sometimes I just have to ask them again, and I have to ask them again. And I'm just saying, for even my elite controllers, they don't even want to go to donate blood. And I'm telling them, you're not getting any medications, you're not anything, you're improving knowledge. I still have them reluctant to go. Okay. So it's just on a person-to-person basis. But like they said earlier, if the patient trusts you, and if you explain it correctly, about the place that they're going to, people, and the purpose of what it is, most of them will buy in. My patients don't even want to be in the DC cohort to use their labs. It's just all kinds of fears out there in our community.
Okay, well, thanks, Dr. Hogan. I guess, of course, I don't know if anybody has the expertise to talk on the different kinds of clinical trials. Dr. Hogan sort of hit on just the blood draw. So there are different levels of clinical trials, phase 1, phase 2, phase 3. But as Dr. Hogan says, treatment studies. So really a lot of the studies that some of the, even the drug companies are doing are not experimental. The medications have been used for other things, and maybe they're trying it on another discipline or another comorbidity of health, something going on. And So there's so many different moving parts when you're talking about clinical trials. The easiest one, as Dr. Hogan mentioned, is a blood draw study. All I need you to do is donate you some of your blood, and of course, there are consent forms, but to donate some of your blood for a clinical trial. And that's just like having blood in the lab just for the scientists to play with, just to see what your genetics look like, what's the difference between your blood, somebody else's blood. But in order to do any of that, you still have to go through a screening process. You have to be in pretty decent health, and it's a process. But you're actually getting reimbursed money for your time, for actually coming up to actually donate your blood. So one of the studies, maybe you might be getting $100 for donating a pint of blood, like they say, and you come back once a year, or once every 2 years, once every 6 months or something like that. So there are different degrees of clinical trials. And Dr. Hogan mentioned also the whole guinea pig thing is not really experimental. So I think that there are studies that the studies actually offer standard of care, which is something that you would get from your primary care. But it's sort of like just having another set of eyes looking at you. So, I sort of come from that standpoint. Like you go to your primary care and the primary care says, oh, you got a lot of stuff going on. Maybe you don't have health insurance. I can't send you to the specialist. Oh, well, there's a clinical trial and they may be able to do all these tests. And we may be able to get some of these results. So it's like having another set of eyes looking at you or following you, even outside of your primary care. And we're sharing the information with your primary care. So there's so many different levels of clinical trials. Phase 1, phase 2, phase 3. Phase 3 is really about safety and efficacy. And phase 1 is really about, is the drug really gonna work? I guess so many different phases of clinical trials that I think, and it's sort of hard to explain to a patient about phase 1, phase 2, phase 3, but from our perspective, we should know the difference between a phase 1, phase 2, and phase 3 so that we can adequately put together a recruitment plan for whatever discipline that we're trying to recruit for. Why do we think diversity is so important in clinical trials? Why should we have Blacks in clinical trials? What's the difference?
I think from a basic fundamental level, Black communities, everyone wants to know. No one is really disinterested in learning. And I think when we're pursuing clinical trials, and then we kind of talked about education and how important that is in the beginning. I've in my experience, when I've engaged groups that I've worked with and discussions about clinical trials, that question of why always comes up. Why are we doing this? What is this for? And then the second question that I've encountered was, what's in it for me? Like, how are they going to support me with this, right? Because some of these folks they're working individuals. Some of them have different life obligations and responsibilities, and depending on what the trial itself is asking for or looking for, this may demand time, effort, that sort of thing, and so. But I think that's one of the reasons why, for me, the social determinants of health is always, important. But I think diversity is important because, we can't assume that only one group is interested and another group isn't. And I think when we're depending on what we're looking for through that clinical trial, we want to also make sure that we are reaching all the populations that could potentially be touched by this specific treatment, vaccine, or whatever case may be. So I think that expands into the aging population or elderly communities. Like, are we engaging, them in some of these trials? Like with HIV, for example, people are living longer with HIV. It's no longer a death sentence. And so with that, if someone's taking HIV regimen or a pill or injection at the age of 75, do we know what those implications are? Do we know what's happening in that stage? So I think those are things I think that's one of the reasons why I think diversity is really important when you're pulling together a clinical trial or looking to recruit for one.
Thanks, Rodney. Great insight. Anybody else want to jump in on that one?
Sure, I don't mind really quickly, Charlita. I think there's some key things. You know, when we have a wide range of people from different communities participating, you know, we aim to really reduce medical biases, we promote health equity, we, you know, we reduce health disparities. And then the most important thing is, again, we produce effective and innovative medical treatments for all that's inclusive. So I think those are some of the important reasons why diversity is important.
Okay.
And I
Anyone
think that, you know, for the most of the a lot of the lay people out there, they question whether treatment as a broad term is one directed toward them or kept away from them. And then lastly is just because it worked in Caucasians or whoever, it doesn't mean that it would work in me. This is their perception. So to have people of color involved in your clinical trials and make this known, if you have them in it, and the public don't know that Blacks were or Latinos were included in this, then again, we talk about health literacy again, and knowledge about health is that people need to know that this medication works. Number one, it works in people like you. Well, just because it worked in adults, does it work in babies? Just because it worked in babies, does it mean it will work in adults? All kinds of things like that. Just because it worked in men, will it work in women? We're talking about the general public's questions. And that this is why your clinical, we talk about diversity, because people have these individual questions. And I can point to it and say, okay, the 20% of the population in that was African American. It was X% women. It was done in 9 different countries, including the United States. It was included in South America. It was in Africa. They had Egyptians in there. I'm just saying, people look for diversity to be able to see and feel comfortable that this therapy will work for me.
Great, great, great. Great answers, great answers, great answers. Is there anything else that anybody would like to comment on? Because actually, to be honest with you, we've actually answered every question on my list in some form or fashion on a lot of different levels. Anything that any of the panelists would like to speak on that they think is important for our audience to hear? Any kind of questions that you would like to have answered?
I don't think that a lot of the people out there in the audience and even practitioners are aware that female participation in the medication or drug trials is often around 10%. I have never understood that. We're talking about since our drugs from the mid-90s on using to treat HIV, Hep C. You look at the percentage of women in those trials, it's absolutely scary. If you look at the percentage of African Americans in most of the trials since the 90s, we are well represented. I'm sorry about my background here, but whoever it is, go to dental, please. But anyway, yeah, I need to make a dental appointment. But anyway, so again, just participation in clinical trials for people that look like you. And I think that drug companies and all have done pretty good. I don't think a lot of people realize that with the medications that I can assure them in just about all I know, African Americans are very well represented.
Good comment, Dr. Hogan. That's very interesting. Dr. Hogan talked about the African American community, and that's one of the groups that I actually focus on in my recruitment efforts. Just for information, women tend to not participate in clinical trials because they're always taking care of everybody else. So I don't know if anybody really thinks about that. So we take care of everybody else around us before we take care of ourselves. We're taking care of our husbands, our kids, our parents. We're all over the place. And we're working in addition to that. And so what happens is that we never want to take the time. Most of the time when I'm recruiting African American
So I think something happened to her feed. I don't know if everyone else can still hear me. Can everyone still hear me?
Yes.
Yes.
Okay, not a problem. I will be until she returns. One of the things that I did want to add so we can keep going and then close this out phenomenally is that, we talked about what are the disparities of why we're not participating. But one of the important things too is actually just understanding the recruitment process to get more minorities. And one of the things that I want to make sure is that we understand that we truly need to find minorities where they are. And, one of my main things is outreach and the recruitment for all types of studies, even studies that don't always have indications that are prevalent in our community, but just really making sure that when we are trying to engage them, that we're engaging them where they're searching and browsing in traditional and digital media outlets. And it's, again, if I can preference that, it's so essential that we share educational materials within the community and really establish programs that raise awareness of the need for minorities in clinical trials, but also on another level of just, ensuring that diversity is in the education of younger students with STEM, so they understand what clinical trials is and the importance of medication at an early age, as well as just the recruitment for more African American doctors overall. And I think if we understand the recruitment process, if we understand the needs at an early age of how to incorporate the importance of medical innovativeness and initiatives, I think that would also help. And Charlita's back.
Thank you. Sorry, you all. Look, my lights went out. The house, in the whole house, they just flashed out and came back on. I apologize. Thank you, DeAndre, for taking the ball and running with it. But as I was saying, that the whole women thing is really big. Of course, we always have a whole lot more men that participate in clinical trials. It actually takes a little bit more effort to talk men into participating in clinical trials as it does in the medical arena as well, to get them to go to the doctors. But the women are a really hard sell, whether they, even when they're really sick, it's a really hard sell, I guess say. So that is a particular group that we need to do a much better job at trying to get more women in clinical trials, and in particularly more African-American women in clinical trials.
I wanted to add too, we talked about it, and one of the other speakers, I think it was Mr. Lewis, mentioned, and I think we're under social determinants of health. Somewhere in there was about healthcare location of your care. So who cares where the location is if you can't get to it? So in terms of clinical trials, you can have clinical trials all over this world. But if the people that you would like to participate, who are being marginalized, who are being left out, talking about diversity, et cetera, again, you need to make sure that you have access to the facility where they are to receive care. So I think that's also a very big one when we're starting to talk about low income communities, people who have financial, housing, et cetera, insecurity. That access to care, we know, is a very big issue. So for clinical trials, just having a way to get them there to be a participant, or as you all did earlier, is to come out. You all, NIH provided hepatitis C treatment in Unity clinics for their trials. So again, you have to kind of think outside of the box when you're trying to be diverse and reach people who have been, quote, marginalized. Transgenders, what about transgender participation? What about other people who are not, I'm just saying, you need to have people who are thinking outside the box. And the last thing is, when they get there, who are they going to see? Are they going to see people who look like them, doing something other than sweeping the floor? I'm just saying that you need to make sure that your nurses, your medical assistant, the people that I go in there and who's drawing my blood, somebody that I'm just saying, this is just making sure that it's all inclusive.
Yeah.
Representation is key. I guess that Dr. Hogan spoke to that. So we like to see people that look like us.
Yes. And there's one thing, and I hate to, I didn't mean to interrupt you, but I wanted to make this statement really, really quickly. And some of the trends that we're seeing in pharma sponsors is that they're hiring people for diversity recruitment. They are partnering with vendors that are promising to help sponsors reach into diverse communities. So, for example, some of the major pharmacies like CVS and Walgreens are planning to expand their stores to acquire primary care clinics to treat patients. And they're also planning on leveraging clinics and clinical trial awareness with recruitments in some of these clinics at their stores. And this is a good way because a lot of these stores are in these deprived areas, underserved and diverse areas. So that's really, really good.
That's a very interesting concept. It'll be real interesting to see how that works. I didn't think it went very well during COVID with the CVS and the Walgreens providing the vaccines and some of the other things, because then the pharmacy actually suffered. I actually shared that before. I couldn't get my regular medication for them doing COVID vaccines on everybody. And at some point, and what happens is the CVSs and the Walgreens never have enough people working to provide all that care. So that's an interesting concept. I guess it'll be very interesting to see if it goes over well.
And I loved the idea that Deonde spoke of earlier, where she mentioned including education on clinical trials in STEM programs. I think that's very important because STEM is something I know in the public school setting. That's where you're seeing a lot of those programs are being developed because of the technology age that we're in now. And so if we're able to start the education on this very thing earlier on, specifically in the Black community, because I worked at a few schools that are housed in Black communities that had STEM programs. And so, and that to me, I think is a very great idea. And I'm hoping that continues to drive forward. The other thing I wanted to highlight too in finding clients where they are is I think that's very important. Representation is definitely a part of that. But I also want to highlight engaging the community networks where the clients that the population that we're targeting with or focusing on with our clinical trials, finding those networks, whether it's a church, whether it's a community-based organization, community health center, clinics, hospitals. Something that I saw as a program manager was a lot of companies are beginning to hold town halls or focus groups with these organizations to educate them on clinical trials that are taking place or clinical trials that they're planning to launch. And what they're also doing in those conversations is educating them on successes prior to, like, we did a trial with this community before, here's some of the outcomes, this is some of the, and I think that's important when you're educating the community leaders and then also disseminating that information to the community itself. So I think those are very, very, very good practices, I think, that will really help continue to drive more participation in clinical trials and also building that trust that we look for.
Rodney, that is so important. When I was at a site level, we went to a lot of community healthcare. We would have a table, we would have a sign-up sheet. And I would honestly say, if I'm just on top of head, that probably about, it may seem small, but it's actually a lot when you're dealing with clinical trials because recruitment can be difficult on any aspect. We would get at least a 3 to 5% increase in recruitment when we went to those community-based events. So events are very, very important when you're able to get to those types of things. So that was a great point.
Yeah, wonderful, Rodney. Great points. I know that we're toward the end of the panel discussion. I wanted to highlight two things. If you want to read more on Henrietta Lacks and what happened with her, the book is called The Immortal Life of Henrietta Lacks, and you can find that on the website. Also, I would like to highlight the National Institute of Minority Health and Health Disparities Strategic Plan, which is on the website as well. And the Tuskegee experiment syphilis study is available on the website. You just Google it and all the stuff comes up and you can read numerous articles just for your own education. Thank you all so much. I think it's like 10:56. I didn't see any questions. In the chat. I don't know if I missed any questions in the chat or not, but I don't see any currently there. But if anybody has any questions, please put them in the chat and we'll try to get back with you to answer any of your questions. It has been a pleasure moderating the panel. Thank you to my panelists for a robust discussion about Blacks in clinical trials. I thought it was really, really great. We answered all our questions. We had a lively discussion. And I hope that the audience got a lot of education from the actual presentation and our panelists who actually are expertise in clinical trials in the community, in the Black community. Thank you so much. And I look forward, Black Health Now and OHG looks forward to your participation next month in our next series. Thank you.
Thank you.
Thank you.
Thanks, panelists.
Thank you.